I believe is going on at Elfie. The second half of the puzzle is the motivation that goes along with that feedback loop so that you can pay attention to it, set goals, achieve them. But it has to do with helping you, Grace, the more finely we can slice that, people like you, eventually to N of one, then that's the power of artificial intelligence as fed by the data streams from these various wearables, implantables. I've been taking care of dermatology patients for 40 years. I can most of the time walk in the room and know what's going on within seconds. But I spend my time talking about the family too, because that bond is something that is therapeutic. It keeps people coming back. And interestingly enough, the AI scribes don't capture any of that. They're trained not to capture that stuff. Connecting the dots would go something like this. There's a set of technologies, wearables, implantables, apps, which can be pulled together. I mentioned multimodal, into a space where they can create an experience that's unique to that individual, which drove a lot of my thinking for both of those books is the supply and demand mismatch. The demand for healthcare services around the world, certainly in the US, is far, far, far greater than the supply of individuals providing those services. So we have to use tools like Elfie and others.
Welcome to Elfie Voices, Rethinking Health. I'm Grace McNamara, and alongside Ophir Regis and Jean-François Legault, we host conversations and guests connecting the ecosystem of health. We talk business and technologies, we explore opportunities and challenges. Welcome to the conversation.
Hello and welcome, Professor Joe Kvedar of Harvard Medical School. It is great to have you on. Before we go anywhere, you've got an amazing background between being an author, between editor-in-chief, dermatologist, a psychologist. You've got an awful lot in your career and history, which is really impressive. And I want to get into some of it. Walk us through a little bit from your side. Give us the whistle-stop tour of all that you have done. And what is the most exciting, I suppose, some of the exciting highlights over the career?
Yeah, thank you. Well, it's been about 40 years, at least in patient care. So I will try to hit the highlights. I am a dermatologist by training. The early 90s, I took a little bit of a detour in my career and wound up, I always say, an accidental tourist in the land of digital medicine at that time. I was handed a project on teledermatology and I just fell in love with the whole idea and never looked back. I was primarily and still am interested in using these tools to improve access to care. And equally importantly, which I know is something that is dear to the heart of your team at Elfie, the idea of behavior change and using these tools to encourage more self-care. So along the way, ran a center, an innovation center at the Mass General Hospital of approximately 60 individuals for about 25 years. And we had some operational responsibilities at that time as well, online second opinions and remote patient monitoring primarily for heart failure. And we did a lot of work with industry doing clinical validation and the like. I've been the senior job at the American Telemedicine Association. We used to call it president, now we call it board chair. I've done that twice, been on the board twice. I'm still a senior advisor there. Along the way, one of the more impactful things I've done is help the AMA on digital medicine reimbursement in the US since 2017 as the co-chair of their digital medicine payment advisory group. And in the last 6 years, been editor-in-chief at Nature, their digital medicine journal called NPJ Digital Medicine. So it's enough to keep me busy and most times out of trouble.
Most of the times out of trouble. I've no doubt you get up to some level of trouble, especially at Harvard Medical School, digital medicine, and writing books in between. Tell me a little bit about the two books, because I feel like you were ahead of your time as well. And the topics that you wrote about are like top of the list today for most people in the industry.
Yeah, it is interesting that along the way I've seized thoughts, opportunities, and many times they have turned out to be ahead of the market, but I promise you I didn't know that at the time. The first book was called The Internet of Healthy Things, and it was written at a time when the Internet of Things was growing and people were getting interested in all these inexpensive sensors and things you could wear and things you could implant. And again, something that's really, I mentioned this earlier, but something that's really I've been passionate about is how can these tools fundamentally change the way we provide care, change the way people respond to those feedback loops, care more for themselves, etc. So it was really about first of all, breaking down what's not good about healthcare in the US and what's wrong with it, which is not news and other people have done. And I don't think it's worth going over those stats because we know them. But the other part was about how the Internet of Things, wearables, implantables, sensors can change particularly individual behavior and put us on a path for improved quality of care. And the second book was really a bit of a follow-on, but I had a co-author for both publications. And the second one, we said that we would like to tackle the intersection between digital health and aging, health technology and aging. And we called that one The New Mobile Age. And it was really similar themes, but more focused on this idea that we're getting older and we've done a lot to improve the lifespan in the last century, but we haven't done as much to improve the health span, i.e., being useful, staying engaged while we're older, staying healthy, and that digital health tools could impact that a lot as well. So thank you for asking about those. And I think people still read them and find them relatively interesting because even though they're 10 years old now, some of the themes are still quite relevant.
Well, they're topics we're still trying to really understand what's the noise and what's real healthcare and what's going to move the needle. So I think it's absolutely relevant. Joe, what's your thoughts then as we have the evolution of all of this space over the last 10 years? We have more data. Obviously, AI, LLMs now are starting to really explode. I mean, the last 12 months in particular has been just off the charts. In 2026, set up to be another leapfrog forward in the world of AI and data and access to what's research and what's quality and so on. What's your thoughts on what are you seeing around this space and what's the concern as well? I'd love to find out.
Well, the whole premise that we worked on with our first book was that feedback loops are important for behavior change. And when I originally got involved in the wearable space, which was, believe it or not, pre-Fitbit, we were monkeying around with this little pedometer, looked about the size of a quarter, and you stuck it on your shoe. It gave you feedback and step counts. And that changed my life because I didn't realize at the time how inactive I was. And I started doing things to get more active. And to this day, I count my steps. And so big deal. And I thought, well, we've solved the problem now. We just have to give everyone these devices. And of course, that is completely foolish because so many people don't really care about feedback loops and don't really care about numbers. So the second half of and again, what I believe is going on at Elfie, the second half of the puzzle is the motivation that goes along with that feedback loop so that you can pay attention to it, set goals, achieve them. And we did a little bit of studying on this, again, between 10 and 15 years ago. And we found that different people have different motivations. Some people respond to, again, just the feedback loop. Some people have goals that are related to finance, like if you pay them money, they'll do better. Some people are in a competition with a loved one. I see that a lot with wearable wrist-worn devices that my spouse and I are trying to close the circles and so forth. So everyone responds a little bit differently, but part of the key and where the use of AI comes in now, and at the time we wrote the book, we didn't call it AI, we called it predictive modeling or something, but it has to do with helping you, Grace, or I'll use you as an example, find the people like you that have succeeded doing X, Y, or Z so you can follow them and know that that path will be predictive for you. And everyone's an individual, and the more finely we can slice that people like you eventually to N of one, then that's the power of artificial intelligence as fed by the data streams from these various wearables, implantables, and others as well. Where did you spend money? Or did you walk around? Let's throw in geo-tracking. If you're out for a walk and at lunch and you're walking towards the cookie shop, maybe it fires a message and says, geez, I'm not sure that the cookie's such a great idea, etc. Right? So it's all of those data streams in the AI world, that's called multimodal, and giving you a unique vision for how you can achieve better success. We can throw in genomic data, we can throw in your electronic health record data, et cetera. So a long-winded answer to the question, but that's what's good. The noise is, I guess it's just that everyone's applying LLMs to everything now. And it gets to the point where you're a little bit numb from hearing new LLM X, Y, or Z doing X, Y, or Z thing. People, unfortunately, some people have fallen off on the science, so they might have a large language model, which, by the way, of course, these are all off the shelf now, right? These machine learning models, and you apply them to, I don't know, data from 50 or 60 people and make conclusions on that, which of course leads to all kinds of potential problems. So I do see some of that. We see some of that at the journal, people who are over eager to show what they think is a real finding and maybe isn't because they haven't done the proper science around it, proper analysis.
Yeah, it's exciting, but as you said, it is concerning. I think that's one of your points. And we talked about this in Boston last time we met as well. And you're talking about Alfie there. It's stacking all those motivations on top of each other. It's stacking all of those evidence-based methodologies for behavior change on top of each other. It's stacking all of the science and the research. And I think to your point about LLMs, it's very important. And it's something that I'm very conscious of as well, because especially as women's health, there's a whole lack of data, which means that a lot of the LLMs can be inaccurate. I mean, there's one good study that I referenced a couple of times. It's 60%, is inaccurate when it's asked questions across the spectrum from cardiology to dermatology and everything else. So, huge problems there. And I think to your point exactly then is when you're building, and Elfie does this as well, it's you got to build the LLM based upon quality research and not just what's out there in the ether, which is not good quality. So yeah, you got to build an LLM with the clinicians who are able to say quality, 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 not quality, shouldn't be included or whatever, and too small a study or biased or whatever. So, and that takes time. But to your point is, it's a bit the noise I see as well is looking at, well, ChatGPT this week and it's Anthropic this week, and then you've got this, and they're just fighting for the top space the whole time, but they're not necessarily coming from a health angle. So I'm hoping that we'll, this is obviously where the likes of and Alfie comes in, being able to build it with clinicians, where we have that capacity and space, and that B2B partnership and structure, where it's not a here's it to every million person, and the faster we make money, the faster we get it to the masses. So it needs to be a little different approach. And very clinical led. So it's very important. I agree with you. And that's one of the reasons why, we work with yourselves, and you work with obviously pharma partners and insurance partners. The clinical teams across all these industries are able to come together in different ways. You mentioned the article there and being editor in chief at the MPJ. Tell me, what is the most exciting, or if you're able to share, like the future, because you see the the 20, 30 years or 40 years you mentioned of the evolution of healthcare. You obviously seen the technology evolution as well, because you started in this space way before the vast majority of clinicians were looking at technology being a complement to the healthcare. What do you think? Where are we going to be if we were to back here in 3 years' time? What's the most exciting space or area? If it's not an LLM and it's not an AI, what might be the most exciting thing?
Well, I'm sure it does include AI. Probably 80% of our submissions now are AI something or other.
80%. Wow.
Yeah, again, it's having a moment. Let's face it. This is a technology that we're going to look back on. It will be at least as impactful as the web browser, at least as impactful as the iPhone was. Those are two that I always call out as being, in my lifetime, huge, but turning the world on its head for different reasons. So it's early days, but for a while it's going to be about figuring those things out. I think the most exciting for us, and this maybe sounds corny, but when it actually works. So the thing about science is we don't publish stuff that, as far as we can tell, we're trying to sort the truth, right? We don't publish stuff that has just advertising or just hype or just marketing, right? We publish stuff that has gone through rigorous peer review, and most of the time there's lines up. And so, if I always say to people, follow us on X, because the people that oversee that for us are always, they do a very nice job of giving the highlight of why a particular paper is exciting. And so sometimes the stuff works. Sometimes you can predict clinical outcomes better. Sometimes you can, the thing that's hot right now is, in the US anyway, is these digital scribes that listen to you and the patient and then create a progress note for the doctor to look at. And word on the street and some in our journal as well is that it does actually save some time and perhaps improve some of the quality of care. Things like that where there's actual, it's not just predictive science. There's actual demonstrated value coming out. And then we write editorials on that, or we have policy discussions, etc. It's a broad interest journal, not just for hardcore scientists. Now, when you ask about the future, I like to quote an American. You probably know the name Yogi Berra. It's hard to predict, especially when it's about the future, right? So it's very tough, and this stuff does turn over legitimately every few weeks. And we are on the ground floor. There's no question. All the goofiness of hallucinations and the models typing out stuff that doesn't make sense and having tools like GPT-0 so you can put text in and see if it was generated by LLMs. All of that will get fixed. It's just because it's early days and people are in an arms race. Things are getting thrown into the market before they're just not quite ready. So I can't say for sure how fast that's going to happen. It does seem to be going logarithmically compared to the other thing I often look at is the adoption of telehealth, because that was something I was a champion of early on. And that took a pandemic and a lot of, 20 years of improved technologies. This seems to be going much faster than that. But the word of caution is we still need human beings. You told a very nice story about using clinicians in your process. The reason is the computers alone just can't do it. We need all that human oversight to make sure that the stuff makes sense and that what it's putting out is accurate and relevant. So will that go away? Gosh, I don't know. People talk about agentic. I'm sure you're aware of that terminology, that somehow you're going to just speak into your computer and that your whole trip will be planned. And people who've tried that to date have failed miserably at it. That's not quite right. So maybe someday, I just don't know if it's in the next 2 or 3 years. I think even though it's moving fast, people have so much hope and hype that we're probably not going to get there in 2 or 3 years.
I think, as you mentioned there, people, especially in healthcare, the healthcare clinicians are essential. They're the last mile, and they're also the ones that can make sure what's quality, right? And I think you're absolutely right. We can, and I see it as more of efficiencies of how do we make the workflow as efficient as possible, right? How do we take out some of the burden, some of the restriction? But and I hope that we're going to free up, and obviously it's public health week, we free up more healthcare professionals to spend more human to human contact and less time in the weeds. I think that to me was where the most exciting space is how do we give back the time that we've taken away from human connection? And it's really helpful. I mean, I'm obviously not a clinician, but I find it really useful to interrogate a little bit of what should I ask? Tell me more about this information or this condition or this medication, so I don't have to spend time in the doctor's office talking about it. I can have that knowledge and hopefully I'm going to have a better, more productive conversation. And that's where I see it being used an awful lot. And to your point then is, if you're getting, especially with complex conditions, if I can take notes digitally while with the doctor and reread them or re-understand them later, then at least when you're getting hard, tough news and, complex information, you don't need to understand every single bit while you're physically in the seat. You can take it away and better understand it and come back with much more nuanced questions for yourself and hopefully spend better time with the clinician. But yeah, I have a funny feeling, healthcare in particular, we're never going to get away from human connection. If we can just get it to be as efficient as possible for both ends of the equation, then I think we have a phenomenally better healthcare system. And I think that's a global thing. And on that, I appreciate it's Public Health Week. It's an important week. And I know you weren't like myself, you posted about taking care of doctors and doctor burnout and how do we look at the population health. What's your take on it this year? Is it better? Are we making strides for population health, for public health? Are we making strides towards clinicians having the better balance? What do you think?
Slow progress. I wish I could be more positive. I think on the population health front in the U.S., it's a tumultuous time. Some of the leaders in our government have just a different view of what a good population health is. And I'm not here to say they're right or wrong, but it's counter to the public health mainstream. And that just creates some challenges. So again, I want to make sure I'm not here to say they're right or wrong or either side, but if they don't all line up together around the same set of principles, then sometimes there's wheel spinning in the middle. That's my point.
Yeah.
In terms of clinician burnout, well, on the one hand, I was talking to someone the other day who's she's just finishing medical school. And I was comparing when I did the first year out in the US is called an internship. And I would say today's young people have a lot more humane schedule than we did, mainly because we as a society understand the value of sleep much better now than we did 30 or 40 years ago, and how it's really, and it's wonderful to see that it's really turned around, that people now, they proudly get their 8 hours, and if they don't, they're, looking at their Aura ring or what have you. So I think on that front, today's doctors, particularly Gen Z, and they have a different view of the world. And it's hard for people like me to get used to that, because I'm basically going to take care of my patients till you take me out on a stretcher. But for some of these others, it's more like shift work. There's a better life balance. So the future looks bright from the point of view of burnout. Burnout's still a problem. We alluded earlier to this notion of having notes drafted for you by AI. That seems to be positively viewed by most doctors. I don't use that technology just because my notes are very terse to begin with, but people seem to like it. They seem to say, there's this term in the term of art called pajama time, where you go home, put your kids to bed, and then you do a lot of work on your clinical stuff. And there's less pajama time with this new technology. So there's some things definitely going in the right direction on burnout, I think. So I would be positive on that one. Public health is just, it's a tumultuous time.
Pajama time. I love the term, but it's kind of scary that you have to finish work, go home, put the kids to bed, and then get back into work mode. Yeah, we definitely need to, when we want to get away from that. And I appreciate I've shared some of the recent updates on Alfie as well. And I look forward to sharing more of Alfie Care, because it is that theme of how do we make it easier on doctors to write notes, how do we make it easier on the patient to understand those notes, and get the more information and research and so on. And then at the same time, building in, what's the new evidence in this space, considering there's more and more evidence coming out, obviously in every discipline, which is great. So yeah, looking forward to sharing more of that. I'd love your thoughts on it at another time. It'll be exciting for sure. So Joe,
Terrific.
Appreciate then, but you're in the space of many different disciplines here, right? So, and dermatology, Western dermatology at Harvard Medical School. I also know that you started off, as you said, in dermatology at a digital solution many moons ago, way ahead of your time. And we talked about at this the last time as well, is obviously now, as you mentioned there as well, like sleep is one thing. All of these areas are overlapping. So it's kind of hard to be a specialist in one, and you're across a few different spaces. Is it changing? Like, do we need to have, doctors that are specialists in one, or is it going to change where you have to have some level of lifestyle medicine, for example, or what's different between women's, space versus men's spaces? Is any of this changing right now? And is technology helping or a hindrance?
Well, there is more specialization. I guess that's generally a good thing, as long as we keep in mind that we're taking care of people and not just an organ or a disease. That's always been my approach. So I spend most of my clinical time chatting with patients, not necessarily because I'm a chatty guy, but because we know that's therapeutic. And so I've been taking care of dermatology patients for 40 years. I can most of the time walk in the room and know what's going on within seconds. But I spend my time talking about the family, and as I said, that bond, and this gets back to the AI stuff too, because that bond is something that is therapeutic. It keeps people coming back. And interestingly enough, the AI scribes don't capture any of that. They're trained not to capture that stuff, which another reason I don't use them, because I'll write down on my note, I saw Grace and her daughter is X, Y, and Z. And so next time Grace comes a year later, I can ask about the daughter. So I think that's really important with specialization. The finer grain data, yes, we'll have women. We do already women's dermatology. We'll have women's health has been to your point earlier, undervalued for centuries. We need to do more in that area. We need to do more in my field in skin of color. We need to do more in many different iterations of specialties. But in the end, it's about the person first and the specialty second. I think that's really important.
And it's a good example you just shared there of how the last mile and the human interaction is never going to cease.
No, I don't
completely agree with you there.
Yeah.
And obviously I do a bit of work obviously in the lifestyle medicine space. And we talked about this the last time as well. You mentioned sleep obviously as a core pillar for health. And obviously one of the 6 core pillars for lifestyle medicine. Social connection is one of those pillars that I think we see an awful lot of challenge with. We talk about male loneliness epidemic right now is, something that's being talked about more and more. And it goes back to your point here is I think we used to have back in when I was starting out, it was very much around older adults, for example, who would have lived alone and may not have had many social interactions. I did a body of work. How do you get more, physical activity into older adult groups and communities and so on? But now it's changed significantly. It's just all of us need to plan and put social interaction into our schedules. Otherwise, we are going to be in front of a laptop.
Too busy looking at our phones.
Exactly. And we're bringing in from different parts of the world today as well. So the social connection, and we know the science around isolation and loneliness. Loneliness is a killer. I feel that's going to be the most talked about space probably in the next 12 months. That is parallel to all this AI and LLMs and so on with it, because we cannot take away social connection being a core pillar for health. And I think you mentioned there, you talk to your patients and you take the time, and there's things that you will notice as the human to human interaction that no AI is ever going to pick up on. And obviously the notes you take, as you mentioned there, lead to not only a quality interaction during that visit, but the next visit as well. Powerful. Joe, what would be your takeaway for the audience that's listening? I appreciate most of our audience are in the world of insurance or pharmaceutical or healthcare delivery or all of the above, knowing that these are all ecosystems that tie together. What would be the takeaway point that you would be talking to if you were to literally talk to the audience today?
Well, we've thanks for asking that, because it's sort of a sum up. We've touched on all these points, but we never did connect all the dots. So the connecting the dots would go something like this. There's a set of technologies, wearables, implantables, apps, which can be pulled together. I mentioned multimodal, into a space where they can create an experience that's unique to that individual, to me, to you. Mine's going to be very different than yours. I'm going to be 70 years old in a year, etc. I'm male, you're not, you're female, etc. So that individualism is really key to our next phase. And we're definitely getting there. I used to dream about this. We're getting very close. Once we get that, and again, then it's about the psychology of how you motivate that person to basically be their own doctor when possible. It's not that we're ever going to relinquish nurse practitioners, doctors, PAs, etc. But there's so much stuff that in the psychology, at least in the US, of, well, my doctor yelled at me or this or that. Take your own responsibility for your own care based on what this system will be telling you and guiding you and doing it in a way that motivates you and that you're happy with, not that you feel like you're being nagged. All of that stuff, again, can be worked out and is being worked out. If you're in the insurance industry, then that means costs are going to go down, because if I'm taking better care of myself, I don't wind up in the emergency room. I don't wind up in the doctor's office. So if you're in the pharmaceutical industry, all of what you do in terms of therapeutics are one of those multimodal inputs to this whole thing. So very important in that regard. And of course, as a clinician, I'm just looking to be as efficient, as you said, as possible in taking care of as many patients. One of the things that we didn't explicitly state, which drove a lot of my thinking for both of those books, is the supply and demand mismatch. The demand for healthcare services around the world, certainly in the US, is far, far, far greater than the supply of individuals providing those services. So we have to use tools like Elfie and others to get there.
Thank you, Joe, for summarising that, because I completely agree. We know that the system has often been dependent, and we each need to take ownership of our health and start to really understand, monitor and take care, and then leverage the healthcare professionals at the right time for the right service and in a way that is beneficial to the system. Listen, thank you so much, Joe. It's been a pleasure talking to you. It is Public Health Week. We are both on the same page. We have more to do. It's an exciting time, and where we're going to be this time next year is going to be very exciting. Where we're going to be this time in 3 years' time is yet to be discovered. So thank you so much, and it is a pleasure. And I will see you soon in Boston.
Thank you for listening to Elfie Voices Rethinking Health. We invite you to connect, share and subscribe. Until next week, stay curious, stay Elfie.